Hello, and welcome to the August edition of Sepsis Chatter. My name is Sue Von Bossi, and I am Quality Consultant for Registry Partners Incorporated. Today's presentation is called Broad Spectrum or Other Antibiotic Administration, abstracting the correct date and time. The information included in this presentation is based on the CMS Specifications Manual for National Hospital Inpatient Quality Measures, discharges July 1st through December 31st, 2022. Before we get started, I just wanted to give a little overview of our presentation today. At the completion of this presentation, the attendee will be able to use the current CMS abstraction guidance to determine the correct initial antibiotic date and time in the following situations. When one antibiotic was administered within the specified time frame, when multiple antibiotics were administered within the specified time frame, antibiotic that was administered prior to arrival, and excluding a case due to the antibiotic being administered greater than 24 hours prior to the onset of severe sepsis. Let's perform a quick overview of the broad spectrum or other antibiotic administration data element. First, the definition. Documentation of administration of a broad spectrum or other antibiotic within the specified time frame. Second, I'm sure that we're all familiar with the suggested data collection question. Was a broad spectrum or other antibiotic administered within the specified time frame? And of course, we know the answers to this. It's a yes or no. And lastly, I just wanted to give a reminder that the specified time frame for administration of a broad spectrum or other antibiotic is 24 hours before through 3 hours after the severe sepsis presentation time. According to the guidelines, while the required route for antibiotics administration is IV, there are exceptions for IO and IM routes with the statement that an IV could not be established. So when determining the route of administration for these drugs, please be aware that certain documents may not have the route included and would not be acceptable to abstract. An example includes some anesthesia records do not include the route of medications given with each entry. However, we do need to see that route. Keep in mind that there may be a pre-printed note on the anesthesia record that states all medications administered IV unless otherwise noted. The EMS records may not include a route, or the IM-IO administration without a note supporting that an IV could not be started would not be acceptable and would not be considered an acceptable route. Let's apply the information that we just reviewed. Assuming that this is the earliest antibiotic given, is this documentation sufficient to abstract this dose? This patient is being treated in the ED for extreme dehydration due to vomiting. Clinical criteria for severe sepsis was met at 7 o'clock. The earliest antibiotic ordered and administered was Rocephin 1 gram IM. Documentation on the MAR includes Rocephin 1 gram IM given at 8:30 on 1/1/22 with the RN signature. For this question, the answer is no. While the documentation includes the name of the antibiotic, the dose, the route, the date and time, and the RN who gave the dose, it does not include the documentation that an IV could not be started. In order to accept an antibiotic as given, the following documentation is required: name, dose, route, date and time, and person who gave it. Examples of other acceptable notations are, for antibiotics given prior to arrival, the documentation must meet these same guidelines, but it is acceptable as long as the antibiotic was given within the specified time frame. It's also okay for one provider, an RN, MD, PA, etc., to document that another provider administered an IV antibiotic as long as the notation meets those same guidelines. How would we answer this question? The emergency room MD documented the following: 1 gram Ancef IV administered in the ambulance today, 1/22/22 at 1300 per N. Smythe, RN EMT. No further administration details documented on the EMS run sheet. For the data element, documentation of administration of a broad spectrum or other antibiotic within the specified time frame, does this ED-MD documentation suffice to answer value 1, yes? The answer is yes. This MD documented all of the required information in his narrative note. So this dose can be abstracted as the initial antibiotic administered, since there is nothing documented earlier within the 24-hour time period leading up to the onset of severe sepsis. So what can't be accepted as documentation that an antibiotic was given? Orders that do not have a sign-off stating that it was completed. Sometimes we run across a sign-off directly next to the medication ordered, as given with date, time, and initials. If any of that is missing, it's unacceptable. If the documentation of administration is missing any of the required information, for example, as we had discussed earlier, the route, it could have all the other information, but if it's missing one piece of the required information, then we would not be able to accept it. Also, it's not acceptable to piecemeal an administration date, time, route, name of drug from more than one source. The example that the data dictionary gives is the ED-MD documented in a progress note that a patient received vancomycin 1.5 grams at 1800. The antibiotic name, vancomycin, and the route, IV, were documented on the MAR, but not the time given. So the guidance is do not abstract the route from the separate document to meet this data element. Also, keep in mind that PO and test doses are also not acceptable. Let's take a look at antibiotic timing. The guidance states, if one or more antibiotics are given within 3 hours following the onset of severe sepsis only, abstract the dose given closest to severe sepsis onset. In this case, onset was at 10 o'clock, and the earliest antibiotic given was the Rocephin 1 gram at 10:10. This additional guidance is focused on an initial antibiotic that is given within the acceptable time frame of 24 hours prior to through 3 hours following the onset of severe sepsis, but not greater than 24 hours prior to that onset. If more than one antibiotic is given, choose the earliest date and time within that 24-hour period. Again, keep in mind, this applies when none of the antibiotics were given greater than 24 hours prior to onset of severe sepsis. Let's take a look at this question. The onset of severe sepsis was 1/5/2022 at 12 o'clock. Which administration date and time would we abstract in this scenario? We've got 1 gram of Rocephin given on 1/4 at 1300. We have 1 gram of Rocephin given on 1/5 at 11 o'clock. We have Zosyn 1/4 given at 1900, and we have Zosyn 1/5 given at 10:30. So since the onset of severe sepsis was 1/5 at 12 o'clock, we would look back for a full 24 hours from that time for the earliest dose given. The Rocephin at 1300 on 1/4 is the earliest antibiotic given. This additional guidance applies to antibiotics administered within 24 hours prior to the onset of severe sepsis and greater than 24 hours prior to the onset of severe sepsis. For IV antibiotics that were given within the 24-hour period prior to the onset of severe sepsis, and that same drug was also given greater than 24 hours prior to the onset, abstract the earliest date and time of administration. I found it's easier to break this process up into time frames. First, note the date and time of severe sepsis. Determine the 24-hour time frame by counting back from the onset time. Look for all IV antibiotic types given within that 24-hour period. Make a small list. To determine the earliest antibiotic given, count back a 72-hour time period prior to the onset of severe sepsis. Select the earliest date and time that any of those antibiotics on your list were given. We're only looking back 72 hours prior to the onset of severe sepsis for this. This example illustrates one drug given for multiple days prior to the onset of severe sepsis. In this example, the onset was 1:15 at 10 o'clock. The antibiotics were administered as follows over the days prior to onset. So we've got 1:11, 1:12, 1:13, 1:14, and 1:15, and they were all given at 11 o'clock. So at this point, what we do is take the 1:15, 10 o'clock, which is the onset time, and count back 72 hours. In this case, the 1:12:22 at 11 o'clock is the initial IV antibiotic administration. This is the earliest documented date and time that falls within the 72-hour limit for review. For multiple antibiotics administered within 24 hours prior to the onset of severe sepsis, and also greater than 24 hours prior to the onset of severe sepsis, abstract the earliest dose given within a 72-hour time period. In this case, the onset is 1:15:22 at 10 o'clock. So we're going to determine 24-hour time period prior to the onset, which would be 10 o'clock on 1:14. So now we'd be looking for what drugs were given within that 24-hour time period. Well, the Rocephin was given at 10 o'clock on 1:15. Vancomycin was given on 1:14 at 11 o'clock. So those two drugs are the drugs that we're going to be looking for within the 72-hour time period from the onset of severe sepsis. We determined that the vancomycin and Rocephin are the two antibiotics that we will be looking for because they were both administered within 24 hours prior to the onset of severe sepsis. Reminder that severe sepsis was 1:15 at 10 o'clock. We determined that the 72-hour time period for review is 1:12 at 10 o'clock. The earliest antibiotic given on 1:12 was Rocephin at 10 o'clock, and this will be abstracted as the initial antibiotic date and time. Lastly, if the same antibiotic was administered within 24 hours and greater than 24 hours prior to the onset of severe sepsis, the case will be excluded from the SEP1 measure. The last two cases that we just reviewed would be excluded from the measure based on this rule. This concludes this month's Sepsis Chatter. Just a few takeaways from today. Always refer to the current CMS abstraction guidance to determine if the documentation of administration of a broad spectrum or other antibiotic is acceptable. The required route is intravenous. However, there is an exception for IM/IO administration with that additional documentation. The same documentation requirements apply to antibiotics given in prior to arrival and narrative notes. Antibiotic timing guidance is lengthy and can be complicated, with the associated tables that describe selecting the correct date and time. Use your resources to understand this guidance. If an antibiotic has been administered within 24 hours of the onset of severe sepsis and greater than 24 hours prior to the onset of severe sepsis, the case will be excluded from the measure. Please refer to the following resources for more information about the SEP 1 measure. Please join us in September for another installment of Sepsis Chatter. The topic will be severe sepsis, blood culture collection, and acceptable delay. Thank you for attending Sepsis Chatter today, and happy abstracting!